Hi, this is Mike Ryan. We're in the midst of COVID-19 pandemic, and one thing that we've noticed that is pretty obvious is that we're doing things remotely. Schools are using Zoom. Um, People from work are using Zoom, and other ways of communicating virtually. And I think what I've seen after we did a recent virtual conference with UCSF was that in talking with some orthopedic surgeons, they were sharing that they were doing about 15, one of the surgeons who's actually the incoming president of the American Academy of Orthopedic Surgeons was sharing that he did 15 consults virtually and really had done none up until that point. So if you're really a student of telehealth and telemedicine, you'll know that this has been a goal that people have been trying to do for, I would argue, for about 50 years. Beginning back in, we just celebrated last summer, the 50th anniversary of the moon landing with Neil Armstrong and Buzz Aldrin, along with my former neighbor, Mike Collins, who was commander of the module. Anyway, they, back then, there was a famous story where, we're doing telemetry from Houston to circling the moon, and Mike Collins' monitoring sensors had fallen off, and Houston said, Apollo, we have a problem, as opposed to Houston, we've got a problem, which was famous in the Apollo 13 movie. And so they actually have video of this, of showing Mike, feeling for his sensors, because Houston said, Neil, why don't you tell Mike that we've lost his read and we can't get his vital signs? And Mike Collins was famously responding, he said, I'll let you know when I stop breathing. And so they got a chuckle. But what it really showed and demonstrated is that we've been doing telemedicine and telemonitoring or remote monitoring for at least 50 years. And I would argue longer than that if you look at Army stations and medical stations that have done remote monitoring for at least 50 years. So I think we're finally at the tipping point for telemedicine and medicine. And actually, we kind of joked around by saying we'll probably no longer call it telemedicine or telehealth, but just call it medicine. That happens to be on using whether it's Zoom or some other type of technology. It really is efficient for clinicians, doctors, nurse practitioner, nurses, and others that are doing preventive work or doing diagnostics or having virtual visits. It helps the patient in that they're at their home. They don't have to either to get transportation or drive over themselves or spend an hour or them waiting in waiting rooms and the like. So I think we're really at a tipping point with the COVID. The CMS, Center for Medicare Services, and all have basically, with COVID-19 in place, have put in payment and also reduce some of the, or eliminate some of the regulations they've had in the past. So I think we're definitely at a tipping point for virtual health, and so basically mental, but to medical health that will happen, and mental health to a certain extent that is happening right now by having virtual visits and virtual appointments. So we'll talk to you soon. Have a good one.